It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Welcome to the Sam Lesante Show, folks. Okay, we're going to give you a health update brought to you by Lehigh Valley Hazleton Hospital, as well as the Lehigh Valley Health Network. #1, my friends, #1. You know, I keep saying about the raising the bar in healthcare. The Lehigh Valley Health Network, second to none, second to none. Today we're going to talk about the primary care services and introduce you to new clinicians coming in like crazy to our area. We're very excited about that. But let me tell you, I appreciate the comments that, you know, when I'm with my wife going to, if we're at Boyer's, wherever, and some of you come up and thank us for having this particular show brought to you by Lehigh Valley Hazleton Hospital. And, you know, I tell many people, throughout the years, we've saved many lives. No thanks to me, but thanks to the hospital who cares, who really cares about what's happening in northeastern Pennsylvania and, for that matter, in Allentown as well. Now, joining me today, no stranger to the area, Dr. Jodi Lenko. She is Vice Chair, Department of Medicine of the Lehigh Valley Hazleton Hospital. She has about 20 titles. We're going to condense it to one. You don't mind, Jodi, do you?
No,
okay.
Not at all.
Now, also joining us, not newcomers, but Dr. Nicole Balchune. Am I saying that correctly?
Correct, yeah.
Okay, I'm doing all right. Sharon Wittenbreder.
Correct.
I'm doing wonderful today. Jodi, how are you?
I'm great. Thank you for having us on the show.
Dad's all right?
Dad is doing great. Still
Your father's
working.
a doctor now. How long has he practiced?
He has been practicing in Hazleton since 1977.
You think he knows a little bit about medicine?
He knows a little bit.
A little
Yeah,
bit,
yeah. He's taught me a lot.
Why
so.
did you want to become a doctor?
Because of my dad.
Is that right?
Yeah, 100%.
So you saw what was going on and how much you...
Yeah.
Your dad's a fabulous person.
Fantastic. Gave a lot back to the community. He's just a great guy and still going strong.
Yeah, and he cares about his patients as well as I see all the doctors. That bedside manner is so important. You know. What's new and exciting in healthcare in the primary care areas?
Yeah, so I think we're going to get into some of the exciting recruitment. That's why we have some of my fantastic colleagues with me today. And we'll get into that a little bit. But we, just as an update, the Leapfrog Group recently rated the Lehigh Valley Hospital Hazleton as a Leapfrog Group rating of an A. So just a little background, it's an independent organization that nationally ranks hospitals across the nation based on their quality and safety, and the highest rating you can get is an A, and it's pretty exciting that our small community hospital in Hazleton was given that prestigious award, so that's very exciting. And just showing you that it's a safe place to come. It's, you know, this is all based on your safety and the patient's patient quality and patient safety at the hospital.
How do they get that input? What input?
There's multiple, evaluations that they go into based on, the number of infections that happen at the hospital, the number of falls that happen, all that that goes into rating these. They're very detailed reports. So we're quite proud of that.
Okay, so you get an award. What does it actually mean to our viewers, to the community?
Just means that if you are sick and you need to go to Lehigh Valley Hospital Hazleton to the emergency room or need to have a surgery, you know that you are going to get good quality care in your backyard, and that's the ultimate goal.
I've noticed that all of the people that are affiliated with LVHN are very nice, very cordial, very receptive, even to the trying times, because everyone who's going to whatever you're going for a test, you're always nervous and concerned, but there's always care there, and I think that's so important, Jodi, don't you?
It is, and because you want to feel comfortable. You're in a strange environment. You're often going there with a concern, and that is the #1 goal: is to make sure our patients feel safe and cared for. It has been very trying over the last few years, especially with the stress on our nursing staff, especially.
Big time.
But we've managed to keep a strong working force. We're building back up our nursing, our nursing staff, both in the hospital and in our outpatient practices as well.
So COVID-19, I even hate to say that word anymore. It's like a nightmare, isn't it?
Yeah. It is. It was.
Yeah. Geez, we don't want to live through that again. Tell me what's happening with COVID-19 and the mask and everything else.
Sure. So fortunately, the COVID is not as much of a nightmare as it has been. So we're in a much better state than we were a few years ago. And because of that, the network, Lehigh Valley Health Network, has relaxed the mask policy. So in almost all of our outpatient facilities, in addition to the hospital, whether it's the waiting room, as long as you are not sick, as long as you don't have any upper respiratory symptoms like a runny nose, a cold, cough, congestion, you no longer have to wear a mask. They are optional.
Okay, so where are we with COVID-19? What's the update? What's happening? You hear all these different kind of concerns, and still get the vaccine, you don't get the vaccine, who's getting vaccine, who's getting sick, all these things. Where are we at?
So in the community right now, we're in a pretty good place. This is similar to some of the lowest levels that we've seen in the past 2 years. So that as of actually this morning, I think I got an email that we had 0 patients in the hospital at Lehigh Valley Hospital Hazleton. So our hospitalized patients are very low, and they are less sick. We are still encouraging our patients to get vaccinated, especially for our high-risk patients. So patients with cancers and especially elderly patients. But the most important thing is having that open conversation with your primary care physician.
What do you know about the vaccine? How well informed are we? Because we hear so many different things. People who got the vaccine, got this, got that, and do we really have a knowledge of what that vaccine is about?
So we know that it works. We know that it's safe, and we know that it's effective. And we've now we are no longer giving the original vaccine, which was the monovalent vaccine, mostly not because of safety reasons, but because it's not as effective because the virus has mutated so much. So now we've started to give what's called the bivalent vaccine. And what that basically means, it has 2 strains of the vaccine, the original strain and something that's a little bit closer to what's circulating in the community. And that just allows a better protection against the virus.
Any after effects from these vaccines?
So those are all still studying. These things take lots of time to look through. Some people do get site reactions, fever, aches for a few days afterwards, and there's nothing that's been proven that's been linked directly to the vaccine that we know of.
Well, I got the 2 shots, and I got a big effect of it.
Yeah, it does have a reaction.
I got handsomer.
It can have, yeah.
I got handsomer. What are you guys laughing about?
That's a great effect.
Yeah, wasn't it?
Yes.
I just I started shining.
Great
It was amazing.
side effect.
You hear all these different things, but I guess in the medical profession, you see things a lot differently, but so I'm glad we are right now, because it was. Now, what is considered primary care?
So we consider primary care your outpatient, basically your services that you would go to the office for, that basically takes care of all of your healthcare needs. Anytime you have a basic concern, any concern, you go to one of your primary care physicians. We consider that internal medicine, which is what the 3 of us are today, and we take care of adult patients, generally above the age of 18. And there are some specialties that specialize in geriatrics or the elderly. There's also family medicine, which takes care of patients from birth to death. So generally, family medicine providers can take care of all ages of patients.
Okay, so how often should our viewers go to a doctor or family doctor?
Everyone should at least go to their primary care physician, whether you're a child, an adolescent, an adult, at least once per year.
Right.
Oftentimes we're seeing patients that have more health conditions and are a little bit more, are a little elderly. So we're seeing them often at least 2 to 3 times per year at least.
Okay, so I'm saying, not me, but I'm saying I'm in good health. I don't need to go to the doctor. Nothing wrong with me. I'm fine. And then what do you tell those people that have what we call thick heads?
So I'll tell you that happens often, and oftentimes it's a spouse or a loved one that's strongly encouraging you to go to see your primary care doctor.
Is there any way you get any kind of symptoms, because you hate to hear things like that?
So that's what we're there to tease out. So you tell us we ask a bunch of questions. You tell us, some people say there's absolutely nothing wrong. Then we start delving into some questions that we're trained to ask. And we can tease out things, and then we start, doing some tests and kind of looking for things if necessary.
It's funny because it's always like they put off and put off. I'm one of those people, so I'm not casting aspersions on anyone. But what happens is sometimes you don't want to go, and then when you do go, you find out, I should have gone because it's either stage 1, 2, or 3, or whatever. All right. So you try your best to address that particular problem. Okay. I'm saying about saving people from this show. I forget what show we did, many of the shows we've done, and a person came over to us and said, you saved my husband's life. You saved my, because we watched the show and I told him, you see, you should do this, and that's important, you know. I mean, if anything's wrong, I guess you need to get it right when it's in this beginning stages, as
well,
you say.
the other thing that the rules and the guidelines of of our medical societies are constantly changing, and we don't expect our patients and our community to keep up with that. Sometimes we have trouble keeping up with those changes. So that's what we're there for, to guide you in which tests you need at which age, based on your family history. If you have a strong history of cancer, of colon cancer, we're going to recommend a colonoscopy a little earlier. Vaccines, there's a whole bunch of things that go into just routine things, even if you feel well.
All right, so we got new people coming in, and we have, not new, but to the area. Tell me about how we're getting all these great people.
Yeah, so our recruiting team has been doing a fantastic job over the last year. We've recruited almost close to 20 physicians and advanced practice clinicians, which are our physician assistants and our nurse practitioners, to the Hazleton area. That's just phenomenal. Given the difficulty we sometimes have to this area because we are a small town, two of the recruits that we have had have recently joined our internal medicine team, Sharon to my right and Dr. Balchune to my far right, and they've just been fantastic additions to the team in primary care. We've also had some about 4 to 5 additions in our family medicine practitioners as well, both 2 physicians at least, and 2 to 3 nurse practitioners and physician's assistants practicing in Vine Street, Station Circle, Mountaintop. Sharon practices at our Weatherly practice, and Dr. Balchune is with me at our Alliance Drive practice. So we have a lot of services available, a lot of opportunity. So if you've never seen a primary care physician, you have ample opportunity to reach out and schedule an appointment.
What a tribute to Lehigh Valley Hospital Network. I mean, you know, the leadership and the fact that, you know, you're able to attract the best. I've seen so much of an improvement in healthcare, you know, in the new innovations, the new technology, et cetera. But to attract people like we have here today, I think that's a tribute to the network, don't you think?
It is, and we're very strongly linked with all of our partners in Allentown. So, you know, we have all the same educational opportunities and the same access to the specialists. So we are a big community in terms of Lehigh Valley Health Network. It's a large medical network, but yet we have a very small community here, so we can provide the services in a close-knit family.
So, my friends, I know sometimes, you know, when you go and you get a diagnosis, you say, I'd like to have a second opinion. Well, I've said this many times. When you're going to the Lehigh Valley Hospital in Hazleton or any branch, you're getting more than one opinion. You're getting second and third because you do confer with other doctors. Am I correct in saying that? So you're getting a lot of opinions. But they're certainly welcome to do, you know, et cetera. But that's still in existence, right?
Oh, 100%. We use our specialists, and we have access to them just like you would seeing them in Allentown. There's video visits, so you don't have to leave the comfort of your home. Yeah. You know, you can see a specialist in Allentown without even leaving your home.
That's great. Anything else new and exciting in the primary care area? I see a lot of doctors here that you
Yeah, so we have Dr. Saul and Dr. Rodriguez who have joined our group recently, both fantastic additions to the team. Alyssa Mangini is one of our physician's assistants. Rosalind Johnson is one of our nurse practitioners. These are all within our family medicine department. In addition to Dr. Wittenbreder here, we have doctors also in our Carbon practice that we've also added, a new hospital in Lehigh Valley. Beautiful hospital.
Beautiful hospital.
Dr. Bruckenaro also sees patients in Weatherly with Sharon. And we have a new nurse practitioner coming to Carbon as well. So we're just continuing to grow. So we're very busy.
Lehigh Valley Hospital Network and Hazleton, all the branches, continue to give you the best in healthcare. Take advantage of that. Take advantage of what we have. Because you want to see you around for a while. I need a lot of viewers, so don't leave me. We'll be back right after this. Well, welcome back to the Sam Lesante Show, folks. And my friends, thank you for making the Sam Lesante Show the #1 talk show in Northeastern Pennsylvania from our scientific poll, Susquehanna Polling and Research. And one of the questions in the polling was, what more can we provide? And healthcare thanking us for all the healthcare shows we have, was one of the top. And that's why we have shows like this brought to you by Lehigh Valley Hazleton, Lehigh Valley Hospital Hazleton, and also the network. I've said this many times, this is an organization, a healthcare system that gives back to the community. But we have two nice people here today. Nicole Balchune, correct?
Correct.
So tell me about yourself, Nicole.
I am actually from the area. I was born and raised in Duryea, moved to Philadelphia for medical school, stayed there a few years after residency and missed the area, so came back to practice here.
Tell me about your background experience.
I went to Misericordia from 1995 to 99, and then decided that I kind of wanted to do a little bit more. I was an x-ray tech and wanted to do a little bit more, so my father said, "You're smart, why don't you go to school to be a doctor?" And that's what also my father changed my mind. So changed my career path and ended up going to the University of Scranton for a couple of years to get the courses that I needed to take the MCATs, and then PCOM, graduated from med school there in 2006, residency at Lincoln from 2006 to 2009.
So Nicole, what do you think you bring to to medicine? What do you think you bring to the table?
I really enjoy the preventive care part of it. When you have a family history that back 30, 40 years ago, we didn't screen for certain things, and we know so much about screening younger generations now and preventing some of these diseases, it makes a big difference in people's lives and staying off medication and just in general being healthier. So preventive medicine is one of my most important things I try to bring home. And in primary care, that's one of the biggest things we do. Like Jodi said earlier, you know, you have to come in once a year or else you don't know what's going on. You don't feel some things going on, you're not sure some things are going on, and that's what we're there to do, is kind of get to the bottom of everything and prevent things from happening, hopefully.
What brought you to Lehigh Valley Health Network?
I have friends that work in this health network and they absolutely loved it. So after talking to them, I did an interview and absolutely loved the office. And it's a very nice place to be with a lot of people that care about you as well as all the patients. It's nice to be a colleague that's cared for.
One question here, and I always like this. What are your special interests, areas of expertise, do you think?
Like I said, the biggest, I think, is preventive medicine. I mean, we do a little bit of everything in primary care, but preventive medicine is definitely one of the things I like to take care of first.
Sharon Wittenbreder.
Correct.
How about that?
Yes.
CRNP, which is Certified Registered Nurse Practitioner.
Correct.
You're in Weatherly now, right?
I'm in the Weatherly
Okay.
Clinic practicing there, yes.
Good. So tell me about yourself.
So I was born and raised in Scranton. I was the fourth of 5 children and about a year between my brother and I. And always was the caregiver toward him. And so nursing, I had a call for nursing early on in life, and had my uncle really support me in, going back to school, because again, you're smart, you could do something with your life. And so I ended up going to Bloomsburg University for nursing. I graduated there in 2000 with my bachelor's degree and took a position at a local inpatient hospital unit that did med-surg oncology. Grew to love that, got a lot of experience, and decided to specialize in oncology. So I accepted a position at an outpatient chemotherapy clinic in Dunmore, and was fortunate enough to continue to care for patients and their families, and still felt like I could do more, that I was capable of doing more. And so I decided after 21 years of nursing to go back for my master's degree and become an adult geriatric nurse practitioner.
Fabulous. I have a special place for nurses, practitioners, assistant nurses, because they really do a lot, and I'll tell you, I admire you, because you have such a great bedside manner, and you're in your Weatherly's a great place. You like Weatherly?
I love Weatherly.
Yeah,
I love
isn't
the
it?
people, because people know people.
Yeah.
Everybody knows one another.
Yeah.
It's a small, close-knit community, and even the office staff have been incredible in welcoming me there.
So why did you decide Lehigh Valley Health Network?
Well, I decided because I too have friends within the network and speak very highly of them, and again was sort of looking for the next step in my career and took a chance and, you know, came down and interviewed at the Weatherly Clinic, which really, you know, wasn't my first intention, but I thought, you know, let me go down and take a look at this, where it's located and the people, and I absolutely fell in love with it. I was like, definitely, this is for me.
I find that people who are involved with they have a passion, especially in healthcare, the passion that you have for your patients. Isn't that correct, Jodi?
It is, and it also brings a breath of fresh air to our practices. You know, as this, you know, as we continue to grow, as my father is on the verge of retirement.
He's not allowed to retire.
He's not allowed to retire. No, I told him that. But it does. It brings you know, a whole new life to a practice when you have a new provider added. So we're so grateful.
It's something. You know, sometimes, my friends, you know, your doctor retires, and you know that breaks your heart. But however, the good news is they got great people like this coming in. You know, not that they could ever replace you like your dad and Dr. Mulin, the great people that I've. But there's so many great doctors that are coming in, so don't fear. You know, you have great doctors. Am I correct in saying that, Joe?
Yeah, absolutely. And it's going to be different, and there's going to be a little change, but you're always in good hands.
Well, I want to welcome you to the area. You've been here before, and I wish you the best. And I applaud anyone in healthcare today. It's a difficult task, but thank you for what you're doing. You know, and all of the people, the nurses, and everyone who works in hospitals or healthcare. I mean. It's a great opportunity, and we're very fortunate to have people like you on board. So anything you'd like to say in closing, like what a great host I am or anything like that?
The best host ever.
Oh, I like you.
And handsome.
Oh, I tell you. And Jodi?
I'm not getting invited back. She's getting invited back.
Well, the numbers are on the screen, my friends. We'll see you next time on the Sam Lesante Show. Thanks for joining us.